Let's talk about red flags during movement. If these things happen, you must reach out to me immediately to determine if it's a major issue that may cause dysfunction if we continue. The first and easiest. During any movement, we want to stop when we feel any pain, even if it's minute. This is the most obvious, but there's a cascading effect where your body will do its best to alter movement patterns to avoid the pain. This sometimes may benefit the body, correcting the incorrect movement pattern to the one that is ideal. But most of the time, it's the opposite. You're altering a good movement pattern to a bad one. Stop, skip, and inform me. Maybe adjust to a core routine for the day, or return to the fundamentals if you're unable to do any of the other movements in the workout without pain. And this is the root of the problem, altering correct and ideal movement patterns to the one that is faulty and will lead to dysfunction. While pain is the most obvious, there are some smoke signals that indicate we're well on the way to developing faulty movement patterns if we do not stop early. During my first session with clients, I often joke that I would rather see blood dripping from the client's eyes and ears from the intensity of the workout rather than having them feel the exercise in their lower back. Feeling the exercise in the lower back in exercises such as the plank is an indicator that we are bracing our core incorrectly or we're in a faulty position. I'll talk about it in more detail in the future, so make sure to subscribe if you're not already subscribed. For now, I just want to cut straight to the point. This mostly relates to clients training with me, but if you feel the exercise in the form of excessive tension or contraction, outside of pain of course, in your lower back, upper trapezius, or for those who really know their body, the supraspinatus, or knees, skip the exercise and inform me. This is different from feeling fatigued and should be quite obvious, but it is always better to skip and plan to resume these exercises another day than to push through and risk injury or set ourselves up for bad movement. The reason why this relates mostly to novice clients training with me is the exercises we are performing do not require movements or contraction of the upper trapezius and lower back. These programs are set up in a way to see if these muscle groups will engage when they're not supposed to, such as while in a plank or during a supported row. As for feeling something is off with our knee, it's a broad indicator just to make sure your leg muscles have optimal length-tension relationship. Hint, often the length-tension relationship is off.